Gents, I'm not a doctor. This is not direct medical advice. Please consult your doctor with whatever information I provide with you here. Only use steroids if they're legal in your country. This is just information I've learned over the past 7 years, and do with it what you want or what you can. Somebody posted on Reddit, I'm addicted to testosterone. How dangerous is it really? He's using 500 to 700 milligrams of testosterone per week. He says he wants to decrease it for his health, but he loves the way it makes him feel. Obviously, most people are going to be like, drop down to test. That's like one of the top comments. Drop down a TRT dose. That's like telling a smoker to stop smoking. It's like, that's not going to happen. I was a smoker. I was a smoker from the age of about 18 to 23. I'd smoke half pack a day, definitely more if I was drinking. And same thing with alcohol. Tell an alcoholic to stop drinking, he's not going to stop drinking, you know? So if there was a way to reduce harm from smoking, then that would be huge, you know, because it's really difficult to get somebody who's a heavy smoker, multiple pack a day smoker, to just quit smoking cold turkey. So if there was a way to harm reduce from smoking, that'd be fantastic. And there is a plethora of ways for harm reduction for testosterone at high dosage. So if you want to blast, here's what you need to do. And I want to make a quick comparison. In Sweden, they give out clean needles to heroin users, which sounds bad, right? Like it would increase the amount of drug usage in the area where they're giving out clean needles. But it's been scientifically proven that the distribution of clean needles to heroin users has not increased the use of heroin in Sweden. And what this is harm reduction, right? It decreases the risk of infection from shared needles and also reduces the risk of transmittable diseases from shared needles like HIV or AIDS. That's harm reduction, right? So with this individual, he's addicted to testosterone, and we want to do harm reduction because just telling him to get off or go down to TRT may not be enough, right? You can scare him into it maybe, but if they're going to just stay on permablast, you got to work on harm reduction. So if you want a permablast, and I'm talking about 500 milligrams per week or less. If you're over 500 milligrams permanently, you're fucking up big time, and you have no excuse, in my opinion. So I told this individual, please at least get down to 400 milligrams per week. If you can still feel good on 400 milligrams per week, please at least get down to 400 milligrams. That's more reasonable. 700 is just too much. There's no way you can't wean yourself down to 400 and still feel great. So I said, please at least consider going down to 400 milligrams per week. Now here comes the way you can prevent disease and see disease coming when you're on high doses of testosterone for an extended period of time. Because I've seen people who have been on high doses of testosterone for years and years and years, 400 milligrams. That's their testosterone replacement dose. And, you know, some people with great genetics can get away with that. But you want to be careful, right? And some of these people with great genetics don't check anything and they get away with it and whatever. But eventually it's going to come back to bite you. And eventually this person will have to come down on their testosterone dosage. Eventually. You can't do this forever. But here's what you need to do if you want a permablast. Again, this is not direct medical advice. Talk to your doctor. You want to get a CMP, which is a comprehensive metabolic panel. It's going to check your liver and kidney health. Testosterone is not liver toxic, right? Injectable testosterone is not liver toxic, but it can cause high blood pressure, and that can cause stress on your kidneys. So a CMP is good to check your kidney health along with your liver health. Then you want a CBC, a complete blood count, which is most important for checking hematocrit. Again, my own personal opinion, talk to your doctor, but when you get cresting over 55% of hematocrit, that's when it starts getting a little bit worrisome. If you're cresting over 55% hematocrit, it's wise to do probably quarterly therapeutic phlebotomies. If you're going to do therapeutic phlebotomies, then you're going to want to do iron panels along with your labs to make sure your iron's not dropping so low that you get low iron anemia. For example, with women, if they're having heavy periods, they can, you know, generally speaking, women's vitamins have iron in them because they have their periods, then they lose a lot of blood. And so they have decreased iron in their blood and they have to supplement with iron. So if you're having therapeutic phlebotomies, you're decreasing your blood volume and you need to check your iron studies to make sure you're not, developing low iron anemia and have a deficiency in iron. So you can reduce the frequency of your phlebotomies or you can supplement with iron, for example. And you want to get a lipid panel to check your lipids, obviously, because testosterone can have a negative effect on HDL and LDL, where HDL, the good cholesterol, goes down, and LDL, the bad cholesterol, goes up. And a hormone labs, check your ultra-sensitive estradiol, total testosterone. If you want to, you can check free testosterone, but at a high dose, it doesn't really matter. SHBG maybe, but it's going to be probably crushed at a high dose like that. It's going to be probably in the low teens, typically speaking. So total testosterone, ultra-sensitive estradiol, might be all you need for hormone labs. And you want to get all of those every 6 months to check on your health and just make sure everything's in check and nothing's going wrong. And more importantly to me, this is the heart, right? So, okay, when you're on high doses of testosterone, there's that problem where you have hyperlipidemia. You can have mismanaged cholesterol, which is a problem for your heart because you can develop plaque in your carotid artery, which can lead to stroke and heart failure and heart attack and cardiac events. Beyond that, side effects of testosterone, right? You could get hair loss, benign prostatic hyperplasia where your prostate enlarges. Things like that you would want to consider and weigh as well, because later in life when you have a gigantic prostate, that's gonna fucking suck. And you just dribble and pee out your dick, and you're gonna have to have medical intervention for that. So those are things that you have to consider as well. So get a full comprehensive metabolic panel, CBC, lipid panel, and hormone labs semi-annually, so twice a year. Also, for this individual, starting today, get a referral to a cardiologist. Have a ultrasound done of your heart to make sure you don't have, well, first of all, any other heart abnormalities. For example, I have a bicuspid valve instead of a tricuspid valve on a heart ultrasound. So I'll probably have to have open heart surgery at some point later in life. But you want to make sure you don't have any heart abnormalities just organically, but also you want to check to make sure that the testosterone is not causing left ventricular hypertrophy. Your heart enlarges. That can increase risk substantially depending on the severity of the left LVH of cardiac events. You also want to get a coronary artery calcium score, which is going to literally measure the amount of plaque in your carotid artery. So getting your lipids checked is great. It is part of the piece of the puzzle, but the coronary artery calcium score literally shows you exactly where you're at.
If you do a CAT scan of the heart and just look at the coronary arteries in a kind of rather crude way and score how much calcium is sitting on the coronary arteries, that can predict risk in an individual.
So a CT scan is when you go inside that tube and it takes pictures, slices of your body, and what it can see in your vessels and in your heart is how white they are, and that's abnormal. So a normal vessel, you should not be able to see white in your vessels, and as that calcium is deposited, you can see that in those pictures.
Right.
Okay.
And the technique's gotten a lot better as time has gone on. And so you can grade that calcium scoring.
So if you go to the doctor and your lipids are messed up, you may not actually know how much plaque is literally in your carotid artery and if you're at risk within the next 5 years of a cardiac event, because the coronary artery calcium score can literally predict within the next 5 years if you're going to have a cardiac event. Also, at your cardiologist, I would request a stress test where they're going to put you on a treadmill, hook you up, and make sure your heart's working normally under stressful conditions. Do this every 5 years. That'd be wise, because the coronary artery calcium score is going to predict if you're going to have a cardiac event largely around the next 5 years. It's one of those things where it's like heart disease is the #1 killer in the United States. You should be, it should be more often that primary care doctors collaborate with cardiologists to do these tests, the ultrasound, the coronary artery calcium score, CAC, and the stress test to determine the health of the heart, so that if there is, a substantial plaque or something like that, they can adjust the a statin or introduce a statin or adjust lifestyle factors, etc. Also, you're going to want to have a home blood pressure cuff. You want to go, whenever you go to your doctor, obviously you're going to get your blood pressure checked, but have a home blood pressure cuff and take your blood pressure weekly. Because testosterone replacement can increase blood pressure, especially if you have a significant increase in estradiol, which somebody on 400 milligrams to 700 milligrams of test is probably going to have a substantial increase in estradiol, which is going to carry water, which can increase intracellular water retention and cause high blood pressure. So having a blood pressure cuff and measuring it regularly is a good idea, because you don't want to put stress on your kidneys, which you can, also collaboratively measure via the comprehensive metabolic panel with your estimated GFR. Primarily to determine your kidney function. So I said to this individual, while I don't support this habit or mindset, if you're going to continue to doing it, these preventative measures will assist you in knowing if you're fucking up your heart or your kidneys. Of course, this could also put you at higher risk of BPH and hair loss, so be advised. Again, I don't support this, but if you're going to keep doing it, I want you to be extremely cognizant of health factors and drop to DRT dose immediately if any red flags pop up. A lot of bodybuilders push through. They see that their heart is enlarging. I've seen this before. They see that they have left ventricular hypertrophy. They see that they have some plaque in their coronary artery calcium score. They have a little bit of high blood pressure. Now they're on all these meds. And you've all seen it. Bodybuilders just dropping like flies because of their steroid use. In a nutshell, that's harm reduction if you're going to permablast. CBC, CMP, lipid panel, hormone panel, See a cardiologist every 5 years, starting today. Get a referral to a cardiologist to have a coronary artery calcium score to see how much plaque you have in your coronary artery, if at all. Get an ultrasound of your heart to see if you have any abnormalities in your heart, and especially if you have left ventricular hypertrophy, because testosterone increases muscle size, and your heart's a muscle, so you don't want that to increase. It increases the risk of cardiac events. And they're going to do a stress test as well to see how your heart performs under stress, which would be, generally speaking, I believe they use treadmills, so they'll do cardiovascular exercise. Again, if you're going to permablast, I highly don't I recommend it as much as I would recommend smoking. I would say go down to a TRT dose and dial that in so you feel good. You can do that, and you can live longer. You know, you're probably carving years off your life if you're going to permablast, but you're carving years off your life if you smoke or drink. So you can do what you want with your body. I don't care, but I just want to make a point that there are things you can do to see things coming down the road, right? With the coronary artery calcium score, if you got plenty of plaque in there, get on you're gonna want to get on a statin and stop whatever the fuck you're doing, because within 5 years you could have a cardiac event. And again, with heart disease being the number one killer in the United States, there should be more of an effort between primary care doctors and cardiologists to collaborate to have a fuller picture beyond just a lipid panel, because the lipid panel tells you a little bit, but not the entire picture, especially in regards to the coronary artery calcium score. So using all these methods of tracking your blood work as well as tracking your heart health through a cardiologist examination is going to help prevent or see if you're having problems, right now, and also help you prevent or see what's coming down the road, so that you can abort what you're doing or take medications to lower your blood pressure, correct cholesterol, and things like that to keep you healthy. If you see any red flags, like I said, if you see a red flag coming down the road, your coronary artery calcium score is high, your lipids are fucked up, your kidneys estimated GFR is getting low. Kidneys have a very limited capacity to repair. It's not like the liver. You can literally cut a chunk off your liver, and your liver will repair itself. It's the only organ in your body that's like that. And your kidneys are like babies. They're like the baby organs in your body. If you fuck up your kidneys, you're not gonna have a easy time coming back. And when you're using high doses of testosterone, as far as your kidneys go, you're going to be worried about focal segmental glomerular sclerosis, which is scar tissue that develops in your kidneys, and you can't undo that. So if your estimated GFR starts dropping, you got to stop what you're doing right now, or you're going to be in a lot of trouble. You do not want to go on dialysis. Okay? So these are ways to monitor your health and to prevent consequences if you want to be on that permablast or perma cruise that some guys want to be on, or are on, and they're not monitoring their health whatsoever. It can be dangerous immediately, and it can be dangerous within the next 5 years, or it can cut years off your lifespan. Always, I would always recommend staying within a healthy physiological range, and I mean all throughout the week. I don't mean just at your trough. So people are injecting once a week and have a trough of 1,000. You're well above 1,000 at your peak. So keeping your testosterone replacement in a way that your testosterone is in a physiological range all throughout the week is going to, have a higher likelihood of keeping your hematocrit in range, your blood pressure in range. You're going to keep your kidney health better. It's going to keep your blood pressure within reason. Obviously there are other factors that can affect that, but you're going to have a higher likelihood of staying healthy while enjoying the benefits of testosterone replacement. Okay, that was a video on managing your health if you're going to want to permablast. Hopefully that was helpful at all, and of course do your own research on that. Talk to your doctor about it, especially if you're on that high dosage of testosterone. It's okay to be honest with your doctor. If they're going to tell you to stop, you're not going to stop. And offer up these suggestions for, a referral to a cardiologist. They'll happily do that, I'm sure, if you're using steroids to monitor your heart health and things like that. Okay, not going to beat a dead horse here. Appreciate you guys listening, and hopefully that was helpful. Talk to you guys later. Bye.